Welcome to Samba Samba. Enjoy the video.
You must halt any self-attempts and protect the eye. Touching risks infection and further damage. Once you stop contact, call your ophthalmologist or nearest eye emergency. Explain whether a lens feels dislocated, painful, or vision is blurred. Make sure to have your medication list, allergies, and ID ready because clinics triage based on risk. While you arrange transport, keep the eye closed, sit upright, and avoid lying flat. This reduces movement and helps preserve ocular structures until a professional evaluates you. At the clinic, the team will examine you with specialized tools to identify lens position and related injury. Imaging like OCT or ocular ultrasound clarifies internal layout. The surgeon then explains whether a simple, supervised repositioning or formal surgical removal in the operating room is safest and why they recommend that route. Make sure to ask about anesthesia type, recovery timeline, and specific risks so you understand the plan. Once you consent, the team arranges next steps and prepares preoperative instructions. After a surgeon removes or repositions a lens, recovery hinges on strict aftercare. Use antibiotics and anti-inflammatory drops exactly as prescribed, attend scheduled follow-ups, and wear the protective shield when sleeping. You should avoid strenuous activity, heavy lifting, and water exposure until your clinician clears you, because those actions increase risk of complications. If you experience worsening pain, sudden drop in vision, or new discharge, seek urgent care. This troubleshooting step is critical because early intervention prevents permanent damage.
Thanks for watching. Consider subscribing if we helped you.